Good afternoon, guys. I've got discussion A for you for today. We're discussing how to reduce medical expenses in the elderly without sacrificing health. Okay, here we go. The phrase how to reduce medical expenses in the elderly without sacrificing health signals a practical guide that shows older adults and caregivers how to lower out-of-pocket healthcare costs while keeping or improving care quality. The surrounding page content focuses on concrete evidence-based tactics, insurance review, drug costs, reduction, smaller use of care settings, bill checks, and negotiation, prevention and chronic care management, and use of free low-cost services. Core strategies explained. Do an insurance checkup. Review Medicare, supplemental plans, and prescription coverage each enrollment period to match benefits to current needs and avoid unnecessary premiums or gaps. Reduce prescription costs. Ask clinicians to switch to generics. Use lower cost therapeutic alternatives. Compare pharmacy prices and use mail order or manufacturer assistance when available. Choose lower cost care settings. Use primary care, urgent care, and telehealth instead of emergency departments or non-emergency issues. To cut fees while maintaining timely care. Audit and dispute medical bills. Check statements for errors. Question unexpected charges like ambulance bills, and negotiate requests and negotiate or request payment plans when appropriate. Prioritize prevention and chronic disease management. Vaccinations, screenings, medication adherence, fall prevention, and self-management. Reduce costly complications and hospitalizations. Use free or low-cost community resources, senior centers. These disease-specific programs, vaccine clinics, and preventative services can lower expenses without disregarding care quality. Practical steps to implement the strategies. Annual benefits review. List current prescriptions, doctor visits, and expected services. Then compare Medicare Part D, Advantage plans, during open enrollment for the best total cost and coverage. Medication audit with provider. Bring a full medication list to appointments. And request generic equivalents or deprescribing where safe. Triage plan for urgent needs. Create triage plan for urgent needs. Create a decision flow. Symptom, nurse, line telehealth, urgent care, ER, to avoid unnecessary ER trips. And associated high bills. Bill verification routine. Keep a folder of all EOBs and hospital bills. Compare changes to expected rates. And contact billing departments immediately on discrepancies. Preventative maintenance schedule. Set reminders for vaccines, annual wellness visits, screenings, and home safety checks to reduce risk of acute events. Leverage local supports. Identify Medicaid wraparound programs, community health workers, and nonprofit assistance that can lower cost for services or transportation. Outcomes to expect and cautions. Expected benefits. Combining insurance optimization, drug costs, tactics, appropriate care settings, use prevention and bill vigilance, commonly lowers out-of-pocket spending while preserving or improving health outcomes. Warnings. Cost cutting must never remove essential care. Always validate switches. For example, medication changes with clinicians to avoid adverse effects. Readmissions that increase long-term care costs. When to escalate persistent billing, disputes, sudden worsening health, or complex medication trade-offs. Warrant clinician case manager or patient advocate involvement rather than an unilateral cost decisions. Quick list, actionable. Review current insurance and enroll optimally during open enrollment. Ask provider about generics and cheaper therapeutic options. Use telehealth and urgent care for non-emergent problems, audit bills and dispute errors immediately, keep up with preventative care, chronic disease, self-management, find local programs that offset costs or provide services. Okay, guys, so that is A for you. I'll be back on with B shortly. Let me put that together for you, and I'll be back on with that. For now, Gator Wellness, take care, folks.